I want to acknowledge from the start the theme, One Health, as we celebrate 60 years, if not 59 years, of medical practitioners working in our country and getting together like this in sharing minds, sharing exchanges of experience, work and findings so that the cause for our people's health is promoted. This year also the twin celebrations, our 50th year of independence has arrived and the 59th year of the symposium. And so as a nation, we are forever grateful. And I want to thank the medical professor from every one of you who are out there in the front lines, whether you're a community health worker, you're a nurse, or you're a doctor, or up to the medical schools and University of PNG. I note the presence of our Chancellor and Vice Chancellor here, and the medical faculty members who've served since the birth of our medical school and our university, and all our nursing colleges and our community health training facilities right around the country. The last 59 years you worked, and for our country, the last 50 years, you have carried our country thus far. Big thank you to Mas Yupla, thank you, Bada area. Thank you very much to the medical workers. If there is any one cluster of professionals in our country that has left an indelible fingerprint, footprint, handprint, and mindprint, if I could use this word, in our country, it has been certainly the medical professionals, and I just want to say thank you very much. From those who have been part of us from outside, non-indigenous Papua New Guineans or friends of Papua New Guinea, as well as Papua New Guineans, you know who you are. History will forever remember you, and I just want to say thank you to all of you. And in honoring those who have passed, let me please, if you all, it's not in my speech lineup of program, but if you can all allow us to pause for 10 seconds, maybe 20 seconds or 30 seconds. It deserves a greater pause and remembrance, but just a little while. I want to pay homage to someone who's very close to me, who accepted me into employment many years back, not knowing that I'm the Prime Minister. It was given me great insight into research-based work that must drive public policy. That's all great respect to Deborah. Professor, thank you for coming by. We really appreciate you coming by. Sorry for the loss of Professor Michael Albers. If I could ask all of you, please let's give him 30 seconds, if not a moment of silence and respect. This is the first session and he's not alive with us. Thank you very much. Professor Alphas and many who have passed are stars for eternity. They have contributed immensely to the construct of what Papua New Guinea is today, and we shall never forget that generation. As a child of rural Papua New Guinea growing up in my early days, seeing my parents, more especially my mother, weep for the loss of her own children because basic health care was not available, drives the deep motivations of my public service today. Sitting here in the comforts of such opulence, many times, not so much those of you who work in the health sector, but many times people of my cluster may forget that people out there in rural PNG still face hardships to this day. Last 48, if not 68 hours has been one of the deepest and moving hours of my public life. I was able to go into Kodidanga, a place colleagues, Professor Alphas is famously known for, lived and worked amongst Kuru people in study of the brains that he is famously known for. They are still remain unconnected, despite Kerama only 20 minutes by helicopter ride, or Lay only 30 minutes by helicopter ride. As I speak today, for the first time, we have vehicles that has driven across from Lay into Port Moresby through that path. 5 years ago, I visited them, unannounced. Just stepping into one Sunday, I decided to fly to that place. And I pick up my phone, call the governor then, Governor Gal, call the works minister then, the work secretary. I said, what are you gentlemen doing this Sunday? One was saying he was going to the golf. I said, I have a better idea. Go to the helipad. And I was able to fence up before. We flew in unannounced into Kaitiba. And the community was surprised. There were only 20 or so people there. They were so isolated, they never knew who I was. They only knew the governor because he was the governor for the last 20 years. They went to him and ignoring me on the side. That was for a fair go for me. I don't live in the basket popularity contest. I was happy they didn't recognize me, but the governor had to point them. Your prime minister is standing there. And they went back to me and they asked me, are you James Marape? I said, I am. And we hugged, there were tears, so thank you for coming by. We have our medical little aid post there. It's very run down. And, but what do you need? I asked them, and they said road. I promised road is coming. And today, by God's grace, 5 years on, it is not a superhighway. So I went with them up there on Friday in the morning, and they came out. Little children dressed still in their traditional regalia, not because they had a choice to, but they had no choice. That was their dress. What they were dressed 50 years ago, they were still dressed in that outfit today as we speak. Later on in the day, I got Chopper to drop me off at Kupiano. I got into a car and we drove to a place. We have linked 300 kilometers of missing link from in between Kupiano and Kadaisu in Marape. Slept in between the way, and the next morning after chat there with the local people, I drove from Abam village to Kadaisu and arrived in Alatau late at night. But apart from the warm welcome received in Alatau, every step of the way, people still in pockets of isolation. And guess what? Who we found along the way? In between the 300 kilometers in Central and Alatau. We found, apart from the village leaders and pastors, we found community school teachers and medical workers, community health workers in those communities. And their memory. And so I want to say thank you to all who serve in rural communities. As a child of rural PNG, the motivation that drives some of us to work is to make sure we do best for our people. It is no fun to see your loved one passed on. 1977, I was in remote Oxford, and some of those of you knew Oxford. Acting Secretary, Mr. Y, have you been to Oxford? I know in devolution of powers, the West Pacific Provincial Health Authority has cast a view over Oxford, but sometimes it pays for us to leave our offices and visit those areas so that you get the mindset of people in the front line of service need. In Oxford in 1978, I witnessed my mom burying her son in Oxford because the child had died of wanting medical services. In 1982, when I was conscious of election in country, I lived in a village where a candidate was picked up by Pangu Party, and the first advocacy for Pangu Southern Road became ingrained in my mind that as a politician you can possibly deliver health and education to your people. In 1982, I had a consciousness of politics and what politics can do. And I wasn't seriously aiming to be a politician when I arrived in university. After leaving university in 1993, I made a conscious choice to go back and work. And thank you, Professor Alphas, for granting me the work and for giving me a space in Terror Research Unit. I was stuck in Terror Research Unit for some time, trying my best to serve the rural community. So medical work is a noble work. You work behind the greatest physician, Jesus Christ of Nazareth. He was the greatest physician. So every Christian in the house here, and every Christian in our medical department working in our country, if you're a Christian and a pronounced Christian, know it right from the start that you work behind the legacy of Jesus, who was healing, caring for the sick as part of his work up there. And your country honors you. And I want to take this time to also pay my respect to others who are here, the seniors amongst us. Professor Seisi Kewa has stepped out of work in terms of regular work. Not too long ago, one of the saddest moments for me was for us not to have farewell Professor Vince properly. He left as humble as he came in. He left silently, and I thank those who paid respect to Professor Vince, who left and is now back in retirement. But Professor Tefrani, yourself, and others who have served our country very well in the medical fraternity, we want to say thank you very much. Of course, PNG Institute of Medical Research, we thank you for the work. And all family who are here in the entire medical fraternity, as well as science and research. I know that for the first time, I think you embraced the agriculture department. So I want to say thank you for embracing this medical symposium in a holistic way. That is proper. Prevention is better than cure in some sense. I go to university, we have Professor Topu Raleigh, amongst our best mind in the field of agriculture and pharmaceutical, in the field of study of plant-based solutions. We do have it in our country. Thank you for embracing this conference from a totality perspective. I want to say Papua New Guinea is a country that has, better than 1975, but we are people that has lived in this space for thousands of years. If you don't believe me, look at Cook. UNESCO, it's an established UNESCO World Heritage Site. Cook has been established as a settled agricultural site for over 10,000 years. That's almost on par with Mesopotamia in the Middle East. So Cook has been established as a settled agricultural site depicting our people living in PNG for many, many thousands of years. We interface with nature, we interface with our environment, and we coexist. What else on planet Earth you would find 1,000 tribes into a symphony of one people, one nation, one country. Say, Yara, this is not just a concept that was built in 1975. If someone carry around PNG Kina, Kina is depicted from our original traditional currency. Kina is not an introduced name. Before 1975 and before even Kina and Toya was birthed, we have societies that traded in Toya and we had societies that traded in Kina. You would ask me from the mountains of Huli, where I come from, or from the mountains of Melpa, where the Western Highlanders come from, the valleys of Melpa and valleys of Huli. How will a Huli chief or person have a Kina shell to trade, to marry, to do business? They were picking it up from their compatriot in Gulf. Trading was going on as coastal Papua New Guineans there traded inland with the inland tribes. So trade and people living with nature and themselves have existed even before 1975. 1975, we were fused into one nationhood. And I want to say, amidst many of our weaknesses and failures, we still blend as one people, one nation, one country, 50 years on, and it is a cause for celebration. Many parts of planet Earth have eroded through one-man rule. Many parts of planet Earth have eroded to military dictatorship. Many parts of planet Earth have eroded to their constitution being torn up more than 2 or 3 or 4 times. PNG sovereignty is underpinned by our one constitution that has kept our one people, one nation, one country running 50 years on. And I want to give you our country's assurance to those of you in the health sector, especially many of the development partners who have stood with us 50 years on, that you are amidst a nation that is vibrant, that protects our democracy, that works to leave no place and no child behind in the best of our endeavors. Please don't blame my past 7 prime ministers. I will not blame 2, although I have contents with only 1 or 2, but the rest I'm okay with in their own time and space. They lived their best for our country. In 1975, when Somaliland invested in this country, guess what? Our GDP was only under $1 billion of Kina equivalent, because at the time Kina was on par with US dollar. So $1 billion of Kina, a nation of close to 3 million people, a nation that lived in islands and valleys and swamps and mountain tops. All in all, 462,840 square kilometers of land called PNG. So the cost of service delivery was so high. And it has been that way even up to today. That is why when I took office in 2019, I made commitment that growing our economy at the earliest to reach 200 billion Kina threshold must be the #1 task of my government. And whilst we try our best to assist health, education, law and order, and all the other sectors, growing economy still remains my #1 task. Because when the economy is bigger, it is able to sustain all sectoral needs, including the health sector. And I do not need to educate you, but you just do research on what is the best cost of service delivery to the health sector, let alone not to mention the other sectors. It is quite expensive. And money simply is not there for us to finance and meet all the sectoral needs in our country, including the education sector. But we, as a government, remains committed not to compromise the health of our people. And I want to give you fullest commitment today that the health sector will continue to receive its fair share of allocation in the context of what we have, so that we could deliver to our people health services and systems that they deserve. As I took office in 2019, I did make commitment to the health sector. Whilst some of these commitments remain outstanding, others have been delivered. And I want to appreciate the fine balance we're trying to run. Those of you here who are strong advocates for the basic health care, and then those of you here who are also advocates and practitioners in the specialist care. Finding the fine balance between these two has been something that my government has been content with and grappling since 2019. When I arrived on the stage again in 2022, having received a mandate from the people at the 2022 elections, I did make key punchlines. One of them must be health accessible to our people. At the launch of our national health plan, we said health must be within 1 hour of reach from our people, whether it's basic care or specialist care or intermediary care. Health services must be within 1 hour of reach. This is a basic measurement tool of whether we are doing our best or not for the health department to be measured against, and that focus still remains that health services must be within reach to our people. It is not a privilege, it must be a right, and it is a right for our people, and we must work to deliver this. And so working in tandem, all of you from research perspective, and all of us, all of you from those in the front line of service delivery, to those of us who are policy makers, we must work together to make sure PNG is ready PNG is able to deliver health services, and PNG is able to take care of people 50 years on and going forward to the next 50. I did also say one thing. In 2022, we must have in our country international standard healthcare. And I said, if you look for international standard, without biasness, but I did make mention, look to the Australian standard. We must have a symphony with the Australian standard of health delivery. I believe they have world-class standard down there. PNG standard must reach that mark, whether it's standard at teaching in our schools and nursing colleges, or standard in actual service delivery. Australia standard is world-class. Let's reach that standard at the very earliest, and together we all work towards that. I want to say at this juncture, thank you very much to those who have participated. In the specialist sector, we have no funds. We ask our state-owned enterprises to assist, as well as government funding. I thank you all now. For the first time, we are able to do kidney transplant and heart procedures at Port Moresby General Hospital. Very soon we will open a cancer facility. That is a commitment we made to our country, and we are now, at 58th year, we are now able to address the specialist care at our level 7 hospital, and to WHO Director in Pacific, to anyone in our Pacific, in our French or Pacific. This facility is open. I have informed our Pacific brothers and sisters that if you from a Pacific Island country, you come to Port Moresby, the cost of you being served will not be international, will be PNG cost of being served in Port Moresby. So for those who live around 3 Mile area, your guest house could be expanding so that you could embrace medical tourism also. This is something we want to also do going forward. And I thank all of you for participating. Thank you to the doctors who get engaged. And I want to complete by pointing some examples. Let's not delay in getting things done in our country. What needs to be done, we must do. And I ask especially those of us who are administrators, those of us who are public policy holders, let's assist the frontline people by serving them well in what we do. I'll give you one example. The anesthesia procedure just launched today was sitting in the cupboards in our government system, not just the health department, but the entire government system. And it had not yet reached cabinet. And a patient was already introduced to the procedures for the patient to be operated upon, the kidney, our first kidney patient. And they could not cut. They could not cut yet until that policy is approved. Had they not found me at Hilton doing another program, not in the health program, another program, and for goodness sake, medical surgeons from outside were going to be operating the patient, assisting Dr. Samson to operate the patient. They barged into the cabinet in the meeting hall and said, Mr. Prime Minister, a patient is already, the anesthesia process has started, we've initiated the process, the candidate is now awaiting you to think of this policy paper. It took more than 4 or 5 years for a system to be running a critical policy paper. And I want to ask for those of us who hold the administrative offices in our country, including health department. We are not high and mighty, we are there to serve those who are out there in the front line making sure they work better. And so for those of us who hold public policy and administrative in this process with the administrative offices, we must work with speed and haste to assist those who are in the front line get things done for our country. As we step into our 50th and beyond, I want to point to you all 2 doctors as examples of what was in the medical space. Dr. said, Professor Isi Kebao, said, sorry for using your name again, you didn't ask me to use your name and I will apologize. But Sekebao, in the early years of his life, he emerged as a good medical doctor, good surgeon, Royal Princeton Hospital, if I'm not wrong, in his 70s, if not early 80s, correct, or late 70s. He went there for study and work, and they asked him to stay there, knowing his acumen and seeing his skill. they gave him a position to work in Australia. But since he came out, instead of working in Australia, he came back to his country to serve his country. Say, God bless you. Thank you. He's lived through the 50 years and he's contributed well through his country. Silently, many times, thanklessly, but he just kept on doing his job. I will also pick on another of his, maybe his young colleague, Dr. Noah Topor. Dr. Noah Topor is a classmate of mine in high school. He was the best science student my class had. Thank you. Again, he didn't ask me to tell his story. There's a rationale of me picking these two generational stories. He was working in Singapore, and I found him one time in Singapore passing through. I said, brother, why are you serving another country? You should be back home serving your own country. Because we are the same peers, or we can speak at a level. And he said, you have been finance minister for some time now. You go back and build a theater so that I can come and serve your country, or our country. And he threw it back straight at me. In any case, fast forward the story, I had become Prime Minister in 2019. And him and Dr. Boko fronted up with me and they marched into my coffee at Airways one evening early in 2019 in Tennessee. And he said, Mr. Prime Minister, you're no longer a minister reporting to a Prime Minister, you're Prime Minister, and everything starts with you. Get me the theater and I will start to operate basically. And so he had come back, we gave him the theater, he's now working in the country. I think a week or two ago, successfully did the first ever transplant in the country. In the midst of scarcity of resources, we are trying our best for our country. And the point about these two gentlemen, I meet all of you. You have your own stories, and I just want to conclude by thanking all of you again. Our international helps, as well as our local help. You have served your country well. If there's anything government can do, I don't mind at all taking constructive, healthy criticisms. In the face of resource constraint, what must be done? Let's not compromise basic health care, but at the same time, give the specialist care to our country, balancing these twin propellers of medical care in our country, supporting the technicians, supporting the research aspect, and making sure standards are improved, and at the earliest give our 10 million people. We no longer have 3 million people in 1975, we have 10 million people with increasing lifestyle-related disease, and the needs of medical service in 2025 going forward, that is quite different from the medical needs of the 60s and 70s and 80s, balancing all aspects of medical service delivery, fixing our medical school, making sure our medical school is competent. Chancellor and Vice Chancellor, please, details, allow them to be on their own, but at close collaboration with UPNG, let us work in that space so that they can train good medical schools, medical professionals, linking with our nursing colleges, and together we could keep our 10 million people secure in the health system that is functioning well to serve our people. I look forward to the outcomes and conclusion of this meeting. Thank you very much for inviting me. Medical professionals, you have saved our country the last 50 years. I ask you all, save your country the next 50 years. Governments will come and go, but medical professionals will live on. Be faithful to your country, because God will honor those who are faithful. Thank you very much.